Since a yearly follow-up, I guess?
Um,
Or how long ago did you see that?
right, yeah, it's been August maybe?
Almost, okay, so not quite a year then.
I'm not sure, it might have been August.
Wrong patient, okay. Everything going well?
Yes, actually, only problem I'm really might be concerned with is, sometimes my energy level is a little lower than desired. I'm not sure if it's from lasting effects from the chemo or, I know I had asked for my thyroid levels to be checked.
Checked, okay.
Because my dad does have that problem as well, so I figured, hey, it wouldn't hurt.
Good,
to check.
yeah, definitely, yeah. And you just saw GI doctors, it looks like.
That's correct, yes.
Kelly Duprier and yeah, you mentioned the key, fatigue and all that. Yeah.
Mhm.
Are you sleeping okay?
Mm-hmm.
Okay.
Yeah.
And let's see if it's, did you hear the results from them or not yet?
No, I have not.
Okay, thyroid level looks normal,
Okay.
which is reassuring, and your blood counts look better too. Your platelets, which were low or had been low because of the chemo effect, and all, it's coming up.
Okay.
Almost, close to normal range. The chemistry is still pending, but when did you have one? Like a month ago. Your liver enzymes were a little bit, still on the elevated side, but we'll see what they are today. I think they're still in process. Yeah, let's see.
So you're looking at the scans from April, the beginning of April, or late March, the blood work,
Late March.
late March.
No, the blood counts are from today. They're already
Oh.
back.
Oh,
The
okay.
blood counts, but the chemistry where they, report liver enzymes, kidney, and that I'm looking from last month.
Okay.
Today's one is still in process.
Gotcha.
You know that Dr. Chaudhary is not here.
Right.
Came to know about it? You came to know about it?
Yeah.
Okay.
I don't know what happened there, but yeah, somebody told me.
Oh, okay. Yeah, now his patients are taken up by Dr. Naved. You haven't met him, right?
I don't believe.
I think you probably saw him in the clinic or the hospital.
I think I have because the Charger was out one time before.
Okay. Yeah, you'll like Dr. Naved
Gotcha.
as much or even more, because he's even, I mean, not that, it's a different personality, but, you will definitely like him.
Okay.
And he probably saw you when you were in the hospital too.
Mhm.
I don't know. Okay. Are you working? Are you going back to work?
No, no.
You live with your mom?
Actually, I moved out.
I think you were with your mom when I saw you or something.
Mhm.
Yeah.
But I still live right across the street. So.
Okay. Good.
Yeah, it just so happens that the house across the street from us, somebody moved out and I moved in. I can have my own space.
Yeah. Okay, and you met genetic counselor. You thought you saw somebody in, good, I don't know, August?
I'm not even sure when.
I think it was May of last year, and then
Wow.
you saw Dr. Raffarsad in the next month.
Okay. So it has almost been a year.
Yeah, almost, close to, yeah.
And I know I just got the port flushed last month, I think it was, and because I hadn't had it flushed in all this time.
Oh, okay, oh, like the whole time?
Right.
Oh, well, that's something that we need to work on. And you haven't had any surgeries, right? I'm trying to figure
Nope.
out. So the last time you saw Dr. Roberts, you were done with the chemo, completed it, I mean, and then you had good response. Patient underwent tumor markers were normalized. Um, Release staging CT done, which showed evidence of stable left periaortic lymph node subciliary 9.9 approach improved from 12 in March and what happened? Well, I mean, did they not decide, did they want, just not do it, the surgery?
Yeah, they decided not to do the surgery because it was, at that point, it was so small that he was like, they'll just do quarterly scans and keep an eye on it.
And you're normally, you don't have any urine tubes or nephrostomy tubes or anything like that?
No, all
You're being
that's
okay?
been removed.
And you've been being okay, no problems with bowel movements or anything? Okay. Yeah, we just had a long break though.
Yeah.
Tumor markers pending. They won't be back today, they will need some time, I guess couple of days. The one that you just had in March was, they just did one of them and it looked good. So that's good, I'm hoping everything will be okay this time too. Okay, chemistry is here. Whatever enzymes are actually going a little high.
And Dr. Kelly,
Yeah.
the gastro, was supposed to be contacting my original, like, hospital that I was when I was a baby, to get all the records concerning those liver ranges because when I was a baby, they were elevated as well. So it's something that has been a problem.
Okay.
So she just kind of wanted to bounce that off
Like
of.
a hemangioma, he said, and then thing. It's just of a cyst. But the numbers should not be, I mean, yes, that liver lesion is, but the numbers, are you on any medications now?
Only no medication, just vitamin. I take
What
a
vitamin?
I take like a 1 a day vitamin.
Oh, okay, just one a day.
A
like
multivitamin.
Oh, multivitamin.
And I didn't even take, I actually haven't done anything today.
So you haven't had any scans recently? You didn't have scans today?
Right.
Well, we need to scan you.
You talking about MRI or
CT scans,
CT?
or even, CT scans or a PET scan, because, your last, no, not probably PET, but start with CT scans, because, your last CT scans were about a year ago. And we were going to do at least quarterly for some time.
Right.
And I don't have a clear explanation for these liver enzymes to go higher. Are you having any problems apart from the tiredness and chemo kind of, chemo brain maybe? No, shortness of breath, cough, abdominal pain, diarrhea.
And I even went to COVID in January. The only thing.
You had COVID?
In January.
Did you have vaccines?
No.
And how bad was it, the infection?
It was light compared to what I hear.
Okay. Did you get hospitalized?
No. I didn't, I just stayed home and drank, you know, stayed hydrated and
Sure.
rested and disinfected a lot.
Okay.
I did have a lasting cough, you know, even after the threshold of, you know,
Mm-hmm.
oh, yeah, it was,
I noticed, others, yeah, I think you had the right orchiectomy, right?
yes,
And then no other masses on the other side or anything like that, no groin swellings, lymph nodes, no pain. Okay. That's what you had mainly, back pain, right, at the
Mhm.
time, yeah.
the early
Yeah,
early 2020,
Right, right.
like, yeah, I think that was April 2020.
Classic seminar interested in gene therapy. That was initially, yeah, about CT scan and abdomen covers in June. Did you finish the whole 4 treatments?
Mm-hmm. I took chemo from November until, what, April?
I think you did maybe one last thing because of the drop in, like one chemo medicine because of the drop in the oxygen level, things, the lung function test. And you don't drink, do you?
I don't
Smoke, drink?
no, I don't do anything.
You're boring?
Not boring. Very boring. Is that in the notes?
I know, just
It's boring.
no, we don't, I bet nobody put that.
Thank you for
Just
saving my
kidding.
boring life.
No,
I appreciate
I'm
it.
just, okay. So overall doing well then.
Yeah,
Let's see,
overall doing great.
what did you do work-wise when you were?
Too much.
I know.
Oh, but to be specific,
Uh-huh.
I landscape and landscaping and I was doing Lord Jesus, uh, what do you call it? Detailing. There we go.
Oh, okay, that's what, yeah.
Yes. Boat detailing.
Yeah, that's what I remember about you, boat detailing, yep.
Mhm.
Alright. Let's see, well, how often does the guidelines say to the should was there an appointment in between? I mean, there should have been appointments in between the last one and now, did you miss them?
I'm not. What you talking about for here?
Mm-hmm.
No, I haven't had an appointment here.
Cause we should be seeing you at least.
And I set this appointment up.
What is that?
The last two appointments I set up
You set up?
to get my port flush and this appointment.
So you were not given any appointments?
No, I called.
Strange, that's very strange. Yeah, so as I said, the numbers look a little higher, liver enzymes, I'm not sure why. You always had some liver enzyme elevation back in, 2021 as well, but the last time you were with Kelly,
Mhm.
they were a little higher here, not all of them, but some of them, and then today, one of them, ALT is a little higher, more higher. They did check, hepatitis and for infection last time, or back in 21.
Mhm.
And I see where you got the COVID infection and then you got tested negative after that. I do not know, but we definitely need to scan you and we'll see what the tumor markers will show. As I said, the tumor markers, these two are pending, but one from, March 21st was normal, that was the AFP. But as you can see here in our guidelines, for bulky stage 2B, 2C and 3 seminoma, you need to have every 2 months history physical and chest x-ray, and then at least every 4 months scan for the first year, and then every 6 months for the second year, and then we can kind of space out. So I'm gonna put in those tests to be done, and we will see you with all those scans in about 2 to 3 weeks, whenever they can schedule.
Okay.
And you're not throwing up, you're not having any diarrhea, you're eating okay, not losing weight,
Nope, not losing weight.
no
I'm
headaches.
still maintaining my weight that I gained
Yeah.
from chemo.
Any headaches?
No.
Okay. Okay. You have siblings?
I don't. I'm the only child.
The only child. Okay. And your mom is doing okay?
They're doing fine. They're doing college work.
College?
My dad is taking classes and my mom helps him.
Oh, your dad teaches?
No, he's a student.
Oh, he's taking classes.
Mhm.
Oh, nice.
And my mom is helping him.
That's so nice.
So I try to
Very
stay out.
motivated.
I try to stay out of the way.
Yeah, you see, they're very motivated, right?
Right.
Yeah.
Yeah. They're like, my mom is 65 and my dad is 61.
Okay. Well, still, I mean,
Yeah.
should have a lot of motivation to study, to
Mhm.
take classes,
Absolutely.
at that age. Listen to you. Put you in forward deep breaths,
Alright.
please. And you said no cough, breathing problems. Okay, now more breaths, please. What happened here?
It's one of those, what do you call it, ganglion cysts
Oh,
things.
okay.
Yeah.
You've had it for a long time?
Oh yeah.
Okay.
It's probably from doing so much grass.
Right.
Good.
Right.
Shucks, I've been cutting grass since I was 5 years
So
old.
how are you spending your days now? If you're not
Um,
working, are you doing anything interesting?
Boy, am I doing it. It's interesting. No, I basically just kind of let everybody make my own schedule.
Yeah.
You know, I have, they'll call me to do, for driving, they'll call me for, my fixing little things here, there.
Yeah.
And then they'll call me to cut grass or whatever.
Sure.
Sometimes, depending on how I'm feeling, I'll say yes or no.
Yeah.
That type of thing.
Very nice. You are a very nice man. All right. I'll bring Dr. Naved, introduce him to you today, and then we will definitely need to have scans and have more closer follow-ups than a
Gotcha.
year apart.
Oh,
All right.
yeah, I agree.
Yes. And I don't know how it did not happen, but definitely we should make sure it's done. Okay?
Absolutely. So you said he's gonna come?
Yes. If you
Oh, he's
could.
still coming.
Yeah.
Okay.
Yeah, please come.
Cool.
Thanks.
I'll just hang out here.
Yes, let's check that. Yeah, I'll be back.
All right. Well, there you have it, folks. They can't figure out why, but I should be having regularly scheduled CAT scans and things to follow up to make sure that the cancer is not growing or, that it's gone would be great.
But here we'll go from here. And like I told her, I just told her I'm the one that made these appointments and scheduled them. Nobody called me. I probably should have done this a long time ago. So, but thank God I'm here and I'm doing good. Alrighty.